Hi Wayne, you're now live. So you can share your screen and yeah, introduce yourself if you'd like.
Excellent. Right, so we are attempting to share technology on technology. So inevitably this potentially, hopefully will not go wrong, but can everybody see our screen?
Yeah, that looks great.
So I will be joined by my colleague Nathan in a minute, but I'm Wayne. I'm from the NHS Kent and Medway Health and Care Academy lead, and we're here to talk about our Health and Care Academy, but in particular, how we as part of the college MOU and the SDF2 bid, what we're using our technology for, how we're using it, and some slight examples of what we've developed so far. When we go to our walkthrough, it very much is the first version, so it's still a beta version, so please be nice. There will be parts of it that we will fast forward a little bit just because teething issues, but it's working fine. And then we've got some other videos after that in terms of our plans for a semi-portable immersive classroom for young people to experience. So essentially, the Academy is a collaboration of healthcare and education partners working together to create a centralized, systematic and sustainable approach, essentially to build a talent pool of work-ready young people to feed into our workforce, both now and in the future. Uniquely to today's conference is an MOU in partnership with KFE on behalf of the 3 colleges and NHS Kent and Medway, which is enabling us to work a lot closer to the 3 colleges to essentially look at our current and future workforce development needs, working back from those needs in terms of headcounts, etc., but then working back from that around the skills, experiences and competencies that need to be met to then work within health and care. So we really are now in a great position to support colleges to show them workforce development needs and then work backwards from that to look at curriculums, to look at programs, to hope that curriculums are feeding into the skills and experiences that need to be developed to feed into that workforce. Essentially, making Kent and Medway a great place to live, learn and work in the future. So with over 350 careers to choose from in health and care, we feel like we are on the periphery in terms of careers engagement from what's happened previously. The SDF2 bid has really given us a wonderful opportunity to be innovative and bring our careers engagement into the future, into the present, but looking forward at future proofing and seeing different ways of and approaches, especially post-COVID, of how we can expose and inspire the next generation of workforce. And to do that, through initially the Academy and the website that's being developed, we're hoping that it will be a one-stop shop to provide clear, concise and relevant information, advice and guidance relating to careers in health and care. An example of that is if we look at T-levels, through the website, there will be a biobank of health and care members of staff, either clinical or non-clinical backgrounds, who will be there on hand to initially speak with young people at careers events if we go into schools or if the colleges are holding an open evening, etc. But if we dive deeper into that, they will be on hand to initially look over T-level curriculum developments, also look at planned equipment and tech, if we're looking at mannequins, simulated care rooms, etc., to see if that or the intended equipment to be used is relevant, fit for purpose and replicated in a health and care setting. But if we look at uniquely to the SDF2 bid, we are working with developers to develop an immersive experience, which is including virtual reality, augmented reality, and what we'll show you today, a 360-degree virtual walkthrough of a hospital that we've had developed with a partner within the MOU. And further from that, our plans to develop a semi-portable immersive experience, living or inspiring or showing young people or experiencing an experience of 5 minutes in the life of a health and care professional. So this will be an example of our walkthrough. So the walkthrough can be delivered either through virtual reality or through the Academy website platform. When it's virtual, it will be with the VR headset, but with the 2 hand controls, you can navigate yourself through a hospital, which you'll see soon. Interact with avatars who will be able to provide information, advice and guidance about their career, how they got there, the skills and experiences required to initially move to that career, but also potential pathways and progressions onto further careers within that job profile. When you're accessing it through our website, it will be like a Minecraft type scenario where people will be able to log on and navigate with the keys on a keyboard or through with a mouse, etc., etc. And then this moves on to our virtual reality. So our plans for careers engagement is through the health and care ambassadors that will be held on the biobank on our website. A school or an education establishment will be able to book a handful of those health and care ambassadors to arrive at a careers event where we will be present at a school or a college. They'll be able to listen to a short presentation around the skills and experience and qualifications they need to gain to initially enter into that career, but also advice around potential progressions, either that be qualification wise or different job roles. And then at the end of that, we will have our tech lounge where all the virtual reality headsets will be there along with our immersive experience, and programmed into those headsets will be a 5-minute experience of a role that they just heard about via a presentation from one of the ambassadors. So for example, if we are able to find a triage nurse who will be an ambassador for us, 5-minute scenario of that job role will be programmed into the headset. So young people will be able to see that it's not just a desk role. It's very much a role where you might go in a family member for visiting time. You might have to go to Bay 2 to speak with a doctor around medications, prescriptions, etc. You might have to go all the way to Bay 7 to speak to another patient who might be in discomfort, etc., etc. So you can actually see, feel, and hear it as opposed to just listen to a presentation. And this will be our portable immersive classroom. So there'll be 3 sides of a classroom, which you'll see later, where young people will be able to investigate a heart, look at an irregular algorithm within a heart, remove chambers of a heart and see how blood flows through and pumps, look at X-ray scans, look at ECGs, be able to perform particular roles, potentially in operating theatre, any other different roles within health and care. We will be able to program a scenario in that immersive experience, which you'll soon see. And finally, augmented reality, which is really an amazing prospect for us, where just by printing out a sheet that has a skeleton on it via an app, when young people have gone home and their parents have asked, what have you done today? Oh, we had the NHS in. What did you learn? Well, young people can now actually show them. So we can hand out printouts, for example, of a skeleton. If the parent and carers download the app, they can hover over this skeleton and up pops a skeleton that will have muscles labeled, bones labeled, ligaments labeled, arteries labeled, the heart labeled, etc., etc. So we will still have a presence in that young person's education away from a physical encounter with us. And now for, hopefully this works. This is the first edition. So this is what do we call it? This is a beta format, but a live first expose of our walkthrough, which is incredibly exciting for us. I will try and navigate through it, but there is commentary and also interaction with the avatars. So it's entering the reception here in the hospital. We have developed it a bit further from what was last shown. So there are moving avatars now, and it's populated more. We've put some artwork.
Receptionists are often the first person our patients see. They use customer service and admin skills to welcome people to a hospital, health center, clinic, or NHS headquarters.
Into brief interaction with avatar, these are further developed as we go into the walkthrough even more. But as you can see, so that this is being demonstrated with a virtual reality headset on. So it will look different if you navigate it with keys, etc., all through the immersive experience. It will soon venture into another room. And as you can see, there's other avatars like here on the right.
Engineer. Engineers in the NHS maintain and repair a range of equipment and facilities, from ambulances to dialysis machines to air conditioning units. All are vital to a high-quality NHS working life.
So I just pause it there purely because with this particular avatar, we've put information on there about a typical working day, what that member of staff might actually experience. And it goes into further detail around the qualification and progression routes within that. But we need to tighten that up, as it's probably too much information.
Apply for incorporated or chartered status. Incorporated and chartered engineers have to keep their skills and knowledge up to date with annual.
We're aware of the tedious commentary and voices, which we will change. But as we said, this is a demo version.
Porters are the heartbeat of NHS hospitals, making sure crucial goods and items are delivered where they are needed most. They are also make sure patients are at the right place at the right time to get the treatment they need.
So it now interacts with two pieces of data.
Emergency department doctor. Doctors working in acute internal medicine assess, investigate, diagnose and manage patients with conditions that exhibit severe symptoms that develop quickly and may be life-threatening.
Healthcare support worker. Healthcare support workers work across a variety of settings, from mental health to children's services. The choice is yours as a healthcare support moving forward.
So that should interact with two pieces of data, I think, an X-ray and an ECG potentially. So you can look at different types of issues. For that example, with the lungs, and this is an ECG report which can be enlarged. Moves into another bay. So across the hall into X-ray and scanning now.
Diagnostic radiographer. Radiography is one of the most innovative aspects of healthcare. You'll use advanced technology to look inside patients' bodies and understand the root causes of their illness, and consult with colleagues on diagnosis and treatment plan.
So if we fast forward that as quite a long-winded explanation, the next avatar we encounter will be more or closer to what we'd be looking to develop, which includes a video.
Hi, I'm Nicola, and an adult nurse working here in Kent. And
so this is more development for it. This is where you can actually start posing the avatar pre-designed questions. So a bit more of an interactive opportunity there.
Medway. How can I help you?
Would you like to come and take a seat?
I manage 3 services and several members of staff. One day is never the same. I have fond memories of my training. I had experience and exposure to all disciplines. Just being able to have that helps you supporting the patient and the family through that journey, which at that time.
Adult nurses are qualified medical experts who work as part of a multidisciplinary team, from diagnosis through every stage of a patient's healthcare journey. They deliver clinical treatment and care to adults of all ages.
So from the right, you can then choose a different question to pose to the avatar.
From the start of your training and into your first job, you'll learn how to observe patients and assess their needs. You'll learn to plan and deliver the most appropriate care for them, and evaluate the results. Building a trusting relationship with each patient is essential. Your aim is to improve your patient's quality of life, whatever their situation. You'll need to take lots of factors into account and juggle many priorities to get the best possible results for your patients. Adult nursing is a rewarding career where you have a real chance to make a difference to people's lives. As part of your training, you can expect to learn new. You proceed through your.
So it's similar to what you've just experienced, and they've gone through all the questions there. What will pop up next is a qualification pathway. Unfortunately, we won't be able to get a high resolution picture for this, which is obviously what we're looking at, but it will show you a progression pathway through qualifications via that BT level, study programs, apprenticeships, and university qualifications to show the progression route within that staff profile.
Your career. A typical adult nurse can expect their salary to start at £X and can go up to £X.
So as you can see, it's not particularly clear, that's as it's not a high resolution photo, but you might be able to make up different routes within that. And once we get those high resolution photos, you'll be able to see that clearer. So if we dip out back to the presentation. So now there's 3 short videos here around how we are working with Generate Healthcare potentially to design us a semi-portable immersive experience.
This particular video, the cardiology one, shows you how simple it is. Just by the use of a few buttons, we can create a very simple switch to area where we can then demonstrate further detail by using 3-dimensional high quality graphics that are fully interactive.
These are sirens. You can see it's a quite a valuable learning tool and a more interactive experience. As you can imagine, a number of young people can work as a team, fulfilling different roles and different scenarios that we can pre-program as part of as an asset. So if we move on to a look at the brain.
The skull and brain, this section shows you once again how through the use of touch we can manipulate a particular image to introduce 3-dimensional drawings, 3-dimensional models of that particular part of the body. And once again you can see the highlighted areas can be used then to go into finer detail on that particular part.
And finally, which is quite exciting, we can actually program our 360-degree walkthrough to be shown as part of this immersive experience.
What we can demonstrate here on the hospital tour is quite simply utilising a Matterport created map of any hospital or any environment. We are then able to literally walk through the entire hospital, identifying individual rooms, and at the same time using those particular rooms as a complete surround scene.
So as you can see, we are very much looking at the use of tech to be that first inspiring encounter with young people for this audience, to not just initially experience what has experienced previously in terms of just a presentation from a health and care professional, but now they will have opportunities to be able to see it, feel it, and hear it. And that is us. So we welcome any questions. Don't know if Mark wants to jump in or.
So much, Wayne. If anyone has a question, please enter it in the Q&A window. Yes, we have our next speaker at 12:30. So if you'd like to stick around for that, please do. We'll go and then we'll come back at 12:30. So thanks, Wayne. And if there are any questions, please do put them in the chat. That would be great. Thanks, Sharon. Sharon said good in the chat. So it seems like everyone enjoyed.